We are going to move into talking about the product service ID, which is otherwise known as the National Drug Code, and the variables that are associated with it in the Part D data. Now, if you've worked with pharmacy data before, if you're a pharmacist for sure, NDC codes are not anything new to you, but maybe hopefully during this segment, you'll still pick up some nugget that will help you as you move through research projects. So the NDC information in the PDE file is contained within the product service ID. Now, this is something that not everyone would understand or think of right away. So you do have to, when you're requesting PDE data, have to request variable by variable. And the product service ID, in the beginning, people didn't necessarily know that that was the NDC code just because of its name. So just note that it is an NDC code, and we'll talk about the format that it's in. This is the information from the code book. There are 3 segments to each NDC code. These are, national standard codes that are used by pharmacy labelers. There are 3 segments. There's a labeler code. So this says who labels it. It's not necessarily the manufacturer. This would be assigned by the FDA, the Food and Drug Administration, and this could be 4 or 5 digits. There's a product code that could be 3 or 4 digits, which is assigned by the labeler. And there is a packaging code, which could be 2 or 1 digit, also assigned by the labeler. Now, this is not, so this is always 10 digits of information, but not always in the same format. So it could have been, 442 or 532 or 541. When we're looking at NDC codes within the PDE, we don't have dashes. So you may be confused, how are we going to figure this out? What Medicare actually uses is a standard called NDC 11, and this is always 542. This was developed by the NCPDP in response to HIPAA legislation, but it's not necessarily the same code that everyone else uses. So you can usually, if you're looking at a drug database, you will usually find maybe an NDC 10 and an NDC 11 or an NDC 9, I think there are even. Just note that NDC 11 is the standard that Medicare uses. So you can always, if you need to take a code and search for it in a different place, you know where to put the dashes, because you put 1 dash after 5 digits, the next dash after the next 4 digits. And these digits, the placement of the digits is important. So if we have ramipril, which is an ACE inhibitor, and we have 1.25 milligram capsules in a 100 capsule bottle. We have the labeler ID, which is 5 digits. We have a product ID. Now, in this case, it's 3 digits. And then we have information about the packaging. So we have our three components of the NDC code. You can see that these 2 lines have different NDC codes because they have different product codes. Now, these product codes are only 3 digits long, and we know that the NDC 11 standard is 4 digits. So what happens is that a leading digit is inserted. So now it's 6570 is our labeler, and then 0110 is the product code, and then we have 01 for our packaging code. So in this case, we have, a different dosage, which means it's a different product. We get a different NDC code, but it's the same drug. And on the bottom line, we have the same dosage, but it comes in a different size bottle. One comes with 100 capsules. The other one comes with 500. So the packaging is different. So now we have 3 different NDC codes for the same drug. Just, slight differences in dosages and package. When you look at the PDE, there is information available on brand name and generic name. These are in the drug characteristics file, and they can be, if you request them, they'll be appended to the PDE for you. And this gives for any given product service ID. Now remember, in the PDE, when we see a product service ID, no dashes. And then we have a brand name and a generic name. You can see that for when a brand name and a generic name are the same, in general, that means that it's a generic drug. So the brand name is never blank, even if it's not a brand name drug. What they do is they, you will see the same as the generic name. We'll make a note about this later as well. You also get information on the strength, because that comes from the product service ID. You know what the strength of the dose is. You know what the strength of the individual pill is. You know the form that the pill takes, or it's not always a pill that the drug will take. So it might be a tablet, it might be a disposable syringe. So you get both a code that describes how the drug is being delivered, and then also we have a description. So you can look at that within the PDE data if you ask for the drug characteristics file. There is also a brand and generic code toggle. So you can see if the values are B for brand and G for generic. So you can get a good, just take a glance at it and know whether this is a brand name drug or a generic drug. In the 2021 PDE, this is almost never missing. It's very seldom to be missing. And you can see that most drugs that are in the PDE are generic and some are brand. When we look at the NDC code, we are going to use it to maybe help us answer some research questions, but it might not be as straightforward as we would hope. So if we think of a question where we're looking at the Part D program as a whole, and we want to say, what are the top 10 drugs paid for by Medicare Part D? How would we answer this in the context of the product service ID? Or maybe we want to know, we've got a cohort of people that we've defined. We've used A and B data to identify people with hepatitis C. We'll be talking about that example. And we want to know, are they taking any prescription drugs associated with that? How are we going to find that particular drug in the PDE? Or we could be interested in identifying drugs, or saying we want a cohort of everyone who is taking a hepatitis C drug. And then we would, ask for the cohort to be created based on product service ID. So if we were trying to answer what are the top 10 drugs paid for by Medicare Part D, we try using the product service ID, we can see if we can answer this question. Which variables are available? We've got product service ID, we've got brand name, we've got generic name. How are we going to answer this? So if we look at the top 10 product service IDs, we get Fosamax as the number one that has the most frequency. We have two different forms of Lipitor, but those are very frequent, so we might feel comfortable saying, well, maybe we'll think about combining them, but at least we know that those are the next two. We've got hydrochlorothiazide, we've got Plavix, anticoagulant or antiplatelet. So we've got, this is easy. We just do a frequency of product service ID, order equals frequency, and we've got our information, right? But is this really what we want? Because we know that, if a drug has 50 different product service IDs associated with it, because it's available in a lot of different formulations and a lot of different packages, maybe this will scatter those too much and we won't actually get a good idea. So we could try generic name. We could look at, if we just do a frequency on generic name, now we see that thyroid medication is the number one. Or then we have lisinopril as number two, furosemide as the third. So now we've got a different list if we're looking by generic name, but we might feel more comfortable that we're starting to get a grouping of like drugs with like, so that we can actually get a better idea of what are the top 10 drugs. We could also go by brand name, and then we get a slightly different. Those thyroid drugs that were number one with generic name have moved to number 5. Lisinopril is up to number 1. So we can't, it's difficult to know what is exactly the question that we're trying to answer. Do we just want to know the top product service IDs? Do we want to know the top brands, generic? Oftentimes people might also group them into therapeutic class, and we'll talk about that in a little bit. But this is what we have available in the data right now. And so these are our options. Now, if we have a cohort that we already know, we want to know what percentage of my study population with hepatitis C, or after a surgery, how long is someone looking at it, or is someone taking a drug after the surgery? So do we care about any drug? We could just, we've got our cohort, we can ask for their PDE events, we can do a frequency, seeing, which drugs are they taking? If we're interested in a very particular drug, how are we going to identify that particular drug? Is it going to be using the product service ID or NDC? Are we going to use brand name, generic name? What is going to be the best way to do this? And if we looked at beneficiaries with hypertension, for example, and we want to know if they fill prescriptions for angiotensin receptor blockers or agonists, we could try to uncover a list of all the generic names and brand names associated with those drugs that we're interested in. Sometimes that's easy. Sometimes there's really only one drug that's available. This is something that's newly able to be treated, and there's only one drug. Maybe it has a couple of different NDC codes, but it's not too hard, or we know that the brand name is always the same. But we do have to make sure that we're not making a typo when we're looking for it, because we're querying a large database. It's easy to say, well, I'm looking for this, look in the data and not get anything back. We're not necessarily looking record by record, although that's an option. We don't print record by record, but we could, take a look. I've got my cohort, I'm looking at, how is the brand name appearing in the data? These are, and the other thing to note is that these are generic and brand. This comes from a data source called First Data Bank that CCW merges and adds for us, which is great, but they are truncated at 30 characters. So you may need to make sure that if you added an E at chlorothiazide, because that's the proper spelling, perhaps it won't pick up in your data. So sometimes you may want to look at how the names are appearing in the data. You could type in all of the product service IDs. If you were looking for all antihypertensives, that might be a lot. You're probably best off finding a database that's going to give you information on that drug class, if that's what you're looking for, or at least, have a file that you are going to compare against versus trying to type them all into your data code. And like I said, there is the empirical approach. You could do a frequency of brand names for this cohort that you're interested in and find out, how is it appearing in the data? Am I missing anything? Am I missing a way that it's appearing? But you do want to make sure, sometimes you've done it and you've gotten an answer back and it's lower than maybe you thought, but that's how research is sometimes. It's always good to do that double check and make sure that you really are capturing everything that you want to capture. If you're looking for any drug, you want to find utilization for a cohort that's already defined. You have nursing home residents, you've got your own cohort of nursing home residents, and you want to know how many drugs are they taking. One thing to note about nursing home stays is that if it's a post-acute care stay, if it's a skilled nursing stay after a hospitalization, you don't see the drugs in the PDE. However, if someone is residing in a nursing home, they might be filling their prescriptions through that long-term care pharmacy, and so you would see their prescription drug events. And Gia will be talking about that coming up as well. And then how do you count the number of different drugs a person took in a time period? So I said, we've got nursing home residents. How many different drugs are they taking? Again, would you count using BENI ID and product service ID? You could, you maybe want to note that sometimes people will receive two different drugs. Maybe they're getting a 20 milligram and a 10 milligram, and they're instructed to take both of those at the same time to get to a dose of 30 milligrams. So if you're just counting the unique product service IDs, you might be counting the same drug that they're taking twice. Are you going to use brand name, generic name? These are these difficult questions that you really have to think about your research question. What are your goals? What are the downsides to overcounting or undercounting in this way? in order to, and sometimes we do sensitivities to kind of say, like, if I'm artificially grouping two generic names together, is that a problem? And then I mentioned therapeutic class. That is not something that is available on the data, but that is sometimes what people are interested in. And so we'll talk about that in a minute, how to think about that. Now, if you want to identify drugs for a cohort, and you're going to identify a cohort based on drugs that someone's taking. So you've got your list of drugs that you're interested in. You can send that to CCW and they can create a cohort for you. However, they do not search on generic name or brand name. They will search on product service ID, but once your cohort is created, that's your cohort. So if you have a very small number of product service IDs, you can do this. If you're at all worried that you might be missing something, you may want to think about a different way of identifying a cohort. So therapeutic class. So you will see this in research studies. They've got anti-diabetics. So any drug that's for that's treating diabetes, any antihypertensives. If you might say, if you've completed your list of product service IDs, you might say, I've got all of the angiotensin receptor blockers. What are therapeutic classes and how might you find them? Because they're not in the data. There are public sources where you can kind of find some therapeutic classes. The Food and Drug Administration has RX norm, and we're going to show that as we do our exercise here. That's one possible. There are proprietary or commercial settings that you can use. And if you're working, for a for-profit or even a university that's kind of got a license, these do have to be licensed and they aren't really cheap, but they do have a lot of information on them. You do have to consider, though, therapeutic class isn't the final answer necessarily, because maybe a drug has more than one indication. It might fall into more than one therapeutic class. Where are you going to put it? Do you care that it's that it's got more than one therapeutic class?